It's Natasha, owner of MedicareRocks.com and Mcpherson Insurance, and I'm here to tell you today about Original Medicare versus Medicare Advantage. So let's get right into it. Beneficiaries have a choice when it comes to their coverage. They can choose to have Original Medicare, which includes Part A, Part B, and Part D coverage, or they can choose to enroll in a Medicare Advantage plan, which combines Part A, Part B, and Part D into one package. There are numerous differences between these two options, including enrollment, coverage, network, billing, prescription coverage, and extra benefits. So, I'm assuming the time has come for you to enroll in Medicare and you're weighing your options. Or you are already on Medicare and you're seeking to understand it a little bit better, as well as weigh your options. So, Original Medicare or Medicare Advantage? What's the difference? How do they work? And some other in-between questions. Today, I'm going to walk you through the differences and give you clarity in an easy to understand, it's kind of quick, as quick as I can do it, slideshow. We'll be going over choices you must make, how and when to enroll, the healthcare coverage you will receive, what a Medicare network is, how Medicare is billed, some extra goodies Medicare gives to you, how prescriptions are covered under Medicare, and some changes you may or may not have heard about. Whew, it's a lot. So, the big question, how is Original Medicare different from Medicare Advantage? Medicare Part A covers a beneficiary if they are to receive Medicare-approved care at a facility, including inpatient hospitalization, skilled nursing facilities, and home health care. For inpatient hospitalizations, the client must satisfy the Part A deductible before Medicare will cover the rest of their care for the first 60 days. If they're in the hospital beyond 60 days, they will pay a per-day copay up to 90 days. Beyond 90 days, the client is utilizing their lifetime reserve days, of which only 60 are available while the client is enrolled in Part A. All charges beyond the lifetime reserve days are the responsibility of the beneficiary. I feel right here it's important to let you know that Medicare Part A and Medicare in general does not cover long-term care. Now, moving on to Part B. Part B coverage. Part B covers a beneficiary's outpatient Medicare-approved charges, including physician visits, outpatient tests and imaging, outpatient rehabilitation, durable medical equipment, and some medications administered at a doctor's office out of an outpatient facility, like chemotherapy and infusions. Each year, beneficiaries must satisfy a Part B deductible. Then they receive 80% coverage for services, leaving them to pay the remaining 20%. There is no maximum on the 20% a beneficiary may pay in any given year. So think of it this way. Part A is hospital insurance. Something bad happens, you have to go to the hospital. Part A covers that. Part B is medical insurance. So your PCP, your regular care, your checkups, all that stuff. So that's how you can kind of remember it. Part A, hospital. Part B, medical care. Now, with Medicare Advantage plans, they work differently and utilize a series of copays, such as set dollar amount for specific services and coinsurances, which would be a percentage paid for specific services, which can be found in each plan's summary of benefits. Each Medicare Advantage plan has their own list of copays and coinsurances, so benefits can vary widely between available plans. Medicare Advantage plans have a maximum out-of-pocket cost, which you may see referred to as MOOP, which make them unique compared to all other parts of Medicare. All the plan's copays and coinsurances apply towards the MOOP, giving the beneficiary an absolute limit on their annual spending for all covered services. However, prescription drug costs and non-covered benefits do not apply toward the MOOP. Now, I hope that could clear up the differences for you. If you have any questions, feel free to reach out to me. Hopefully we understand the difference between Original Medicare and Medicare Advantage. So here's how to enroll. Enrolling in Original Medicare happens during 3 distinct times. The initial enrollment period, which is referred to as the IEP, the general enrollment period, which is the GEP, and a special election period. which can be seen as a SEP or, as people call it, a SEP. The initial enrollment period is centered around the beneficiary's 65th birthday month and begins 3 months prior, the month during the birthday, and ends 3 months after. If the beneficiary chooses not to enroll during the IEP, the initial enrollment period, they have the opportunity to enroll it during the GEP, which starts January 1st and runs through March 31st, with benefits beginning on July 1st of that year. These days, many individuals are choosing to work beyond age 65 and may delay enrolling in Medicare if they are covered by a group insurance based on their or their spouse's current employment. They have the ability to enroll anytime they are covered by the group plan and up to 8 months after they lose employment or their coverage, whichever happens first. Like original Medicare, enrolling into Medicare Advantage plan can happen during specific timeframes, including the initial enrollment period, annual enrollment period, open enrollment period, and numerous special election periods. Each year, all beneficiaries have the ability to enroll into, change, or cancel their Medicare Advantage coverage during the AEP. There's the annual enrollment period, which starts on October 15th and runs through December 7th, with any change going into effect January 1st. Individuals already on a Medicare Advantage plan can utilize the open enrollment period to make a one-time change to their coverage. It's also important to note here that each year, all beneficiaries of Medicare have the ability to enroll into, change, or cancel their Medicare coverage during the AEP, which is the annual enrollment period, which starts on October 15th and runs through December 7th, with any change going into effect January 1st. Individuals that are already on a Medicare Advantage plan can also utilize the OEP, which is the open enrollment period, to make a one-time change to their coverage. From January 1st through March 31st, they can change their Medicare Advantage coverage, disenroll, and go back to original Medicare and enroll into a standalone Part D plan if they wish. Outside of the initial enrollment period, the annual enrollment period, and the open enrollment period, beneficiaries may have the ability to enroll or change or cancel their Medicare coverage utilizing a special enrollment period. The most common special enrollment period is lost group coverage, qualifying for Medicaid or extra help, or change in residency. Okay, are you still with me? So, how much does it cost to have original Medicare? The deductible is $1,484 per benefit period, and this is in the year of 2022 when I'm filming this. This benefit period starts when you go into the hospital or a skilled nursing facility and ends when you've been out for 60 days in a row. Remember before I kind of talked about certain hospitalization days with Part A, so now we're going to go into the pricing of those. So days 1 through 60 would be a zero copay, so you don't pay anything. Days 61 through 90 would be $371 per day, and days 91 and beyond would be $742 per each lifetime reserve day. And remember, lifetime reserve days are 60 extra days used only once over the course of your life. Beyond your lifetime reserve days, you would pay at all costs. So the cost for Part B right now, at the time of filming this video in 2022, it's a $233 per calendar year deductible, and 20% of the Medicare approved amount, with no out-of-pocket limit. I hit on this a little bit earlier, but just to remind you, Medicare pays 80%, you pay 20%. If you think this is a little bit expensive, when you have original Medicare, you are able to look into a Medicare supplement plan. What a Medicare supplement plan will do is cover some of these costs for a monthly fee. Today, I'm strictly focusing on original Medicare and Medicare Advantage. However, there is a video on YouTube and MedicareRocks.com which explains Medicare supplement plans in depth. Now, how does the cost differ in original Medicare to Medicare Advantage? With Medicare Advantage, you have co-pays and co-insurance for services, which are set by the carrier you choose. There's so many carriers out there. That's why it's really important to work with someone who knows about the carriers and what they offer. So you have something called copay. That's a set amount for specific services. For example, $10 per doctor visit, or $300 per day for inpatient services. There's also something called the co-insurance, which is a percentage for specific services. For example, if you were to have an outpatient service, that could be 20%. Co-insurances are usually based on carriers' contracted amounts for services. I had mentioned the MOOP earlier, which is the maximum out-of-pocket. This applies to Medicare Advantage. which limits on out-of-pocket spending. $7,550 is the highest allowed MOOP plans can offer. And just so you know, plans can also offer a lower MOOP. Here's how care coordination comes into play. Beneficiaries with Original Medicare can see any doctor or facility that participate with Medicare, which as of 2022 is 93% of all doctors and over 5,300 hospitals in the country. Medicare Advantage beneficiaries must utilize a network of providers for coverage based on the type of plan they are enrolled in, which could be an HMO, which means beneficiaries must utilize in-network providers to receive coverage for services except in emergency or urgent care situations. It could also be a PPO. Beneficiaries can utilize the plan's network of providers and facilities to pay the lowest co-pays, co-insurances for covered services. They are able to go outside of the network, but will pay higher out-of-pocket costs, and they must still see a provider or facility that participates in the Medicare program. So once again, Original Medicare, you can go anywhere that accepts Medicare and you aren't required to have a primary care physician. No referral is needed. You can do whatever you want as long as the doctor accepts Medicare. So that's the difference between Original Medicare and a Medicare Advantage when it comes to care coordination. Physicians that accept Medicare are broken into two categories, either participating or non-participating. A participating provider accepts Medicare assignment, meaning they agree that Medicare's limit for each service is payment in full. These providers bill Medicare directly for services and they are paid directly from Medicare. Non-participating provider accepts Medicare clients, but they do not agree to accept Medicare's limit for services. They are allowed to bill up to 15% higher than Medicare's approved amount. These providers will bill Medicare directly, but Medicare will pay, and then it's the beneficiary's responsibility to pay the provider. There are also excluded providers that do not participate and are unable to bill Medicare for any services. It is the beneficiary's responsibility to cover the cost of services received from excluded providers, as Medicare will not reimburse for any expenses. As far as Medicare Advantage plans go, Medicare Advantage plans take the place of Original Medicare when it comes to billing. Providers bill the plan directly for services, and the plan will pay them back directly, leaving the client to pay any applicable co-pays or co-insurances for covered services. If there is an issue with billing, both the provider and the client can reach out to the plan for assistance. Just to sum that up, if you choose to go with the Medicare Advantage plan, here's how you would be billed. Provider bills Medicare Advantage. Medicare Advantage pays provider directly. You, the client, pays provider any applicable copay and coinsurance. Original Medicare provides few extras, but those that are provided are essential to help a beneficiary stay healthy and active. Upon enrolling in Part B of Medicare, each beneficiary qualifies to receive a full physical within 12 months of joining that will be paid 100%. Afterwards, Medicare will pay for an annual wellness visit, which is a list of questions that are reviewed with the beneficiary and covers a wide range of topics, including physical, emotional, and medication adherence, any concerns, and so on. Original Medicare also covers a wide range of preventive services to help beneficiaries detect any illnesses or diseases early, including bone mass measurements, cardiovascular disease screenings, cancer screenings, colonoscopies, diabetes screenings, mammograms, and many others. As far as Medicare Advantage plans go, Medicare Advantage plans include all of the extras from Original Medicare, plus other benefits, which make the plans very attractive to some beneficiaries. These benefits vary by plan, but these extra benefits may include dental, vision, hearing, fitness, transportation, chiropractic, acupuncture, annual physical, post-discharge meals, telemedicine, over-the-counter supplies, and many more. Beneficiaries can refer to their plan summary of benefits for a full list of extra benefits. Once you sign up with Original Medicare or Medicare Advantage, they like to offer benefits to you at no cost. Prescriptions. Beginning January 1st of 2006, Medicare beneficiaries could enroll in Part D of Medicare to help cover the cost of their outpatient prescription drugs. Those on Original Medicare would sign up for a standalone Part D plan that's provided by a private insurance company. Many Medicare Advantage plans include Part D coverage that is built into the coverage, so the client receives their health and prescription benefits from one company. These Medicare Advantage prescription drug plans are referred to as MAPDs. Clients with a paid fee-for-service Medicare Advantage plan have the option to purchase a standalone Part D plan. We touched on prescription drug coverage just a little bit before. I want to give you some quick reminders. Original Medicare does not come with prescription drug coverage. You must purchase a separate Part D plan from a private insurance company, or else you will have to pay full price for prescriptions out of pocket. Also remember, for every month you don't have coverage, you will receive a penalty that you'll have to pay for the rest of your life when you finally do get coverage. Don't forget, there are options to have prescription drug coverage in place that are low cost and will keep you from the penalty if you aren't taking prescription at the time of Medicare enrollment. It's also important to set yourself up to be fully taken care of should a health crisis occur. When picking a plan, it's also important to check out the formulary. Every plan will have a different one. So like I always say, what works for a friend probably won't work for you. A formulary is what different Part D plans will cover and at what price. My office uses comprehensive software and tools that can coordinate this all for you. When it comes to Part D and Medicare Advantage plans, most Medicare Advantage plans come with Part D unless you have a paid fee-for-service plan. This is the only instances where Medicare will allow you to purchase a standalone plan. Medicare Advantage plans are still subject to Part D formulary, so it's extremely important to work with a guide to make sure your care is coordinated with your prescriptions. Imagine if all your care was taken care of, but your prescriptions weren't covered, or you had to move to a new medication because the one you're on now isn't covered on the formulary. This could become costly for you in all ways. Just so you know of a major change that happened in 2021, Medicare Advantage plans started accepting beneficiaries diagnosed with end-stage renal diseases. Individuals with end-stage renal disease have historically not been eligible for most Medicare Advantage plans. When it comes to Medicare, it's important to work with someone who can assist you through the process, who will make things easy to understand and less time-intensive. My office is knowledgeable regarding Medicare and the different working parts of it. We also utilize state-of-the-art software that tells us about the plans in your area, what plans will and will not coordinate your care with the same doctor, while also covering your prescriptions and offering the benefits you desire. All that time you would have spent bookmarking pages, printing pages, copy and pasting to your loved one, and then having them assist you to compare or find information online themselves doesn't have to happen. I hope I have answered some of your questions, and if you have any more questions, please feel free to contact me. I'm here for you, and remember, my assistant is always complimentary. Medicare agents are compensated by the plans they represent. We are not compensated by you. Thank you for allowing me to explain Original Medicare and Medicare Advantage. You can schedule some time to chat with me quickly by clicking on the link attached with this video.